I'd like to introduce our next speaker, which is Kristie Naines, Executive Director of Brain Tumor Network. Kristie has worked in the non-profit and healthcare sectors with a desire to serve the community. Her experience with a rare cancer diagnosis has turned into a passion for helping others with the disease. She spent many years at Mayo Clinic, connecting with patients on a personal level and helping to inspire others to advance research and excellence in patient care. As Executive Director of Brain Tumor Network since April 2019, Kristie's vision is to provide the best navigation experience with compassion while strategically evolving to reach more patients and more caregivers. Kristie's topic today will be on brain tumor patient navigation. I'll hand it to you, Kristie.
Thank you so much. Good morning here in Florida, and thank you for allowing me to be here today. It's a pleasure. Next slide, please. What is patient navigation? This is a fairly new profession, probably in the last 10 to 15 years, and we view it as individualized assistance offered to patients, families, and caregivers to help overcome healthcare system barriers and facilitate access to quality healthcare from pre-diagnosis through all phases of the cancer experience. So really, we view it as trying to help families understand their diagnosis and find the best care for them at the right time. Next slide, please. You will hear actually from Dr. Suzanne Chang, you just heard from. She did a video for us to explain what is personalized navigation. So if you wouldn't mind, go ahead and play the video.
Hello, my name is Dr. Suzanne Chang, and I am the Director of the Division of Neuro-Oncology at University of California, San Francisco. The diagnosis of a malignant brain tumor is frightening and challenging, not only because patients face a serious illness that has a poor prognosis, but also one that can have significant effects on their physical, emotional, and cognitive health. Navigating the course of their journey can be overwhelming, not only in terms of understanding the disease and treatment options, but also having to deal with the complexity of the healthcare system. The multidisciplinary approach to the care of the brain tumor patient is critical to address management options across the disease trajectory to ensure that outcomes are optimized. And one of the critical members of the team is the patient and caregiver navigator, whose role is to assess the individual needs of the patient and the caregivers and link them to important support resources. They also provide education to improve knowledge and practices regarding the disease and enhance communication across the members of the team.
Thank you. Next slide, please.
If you live in a qualified zip code, you may be eligible to receive USA-made solar panels for no cost at install and get paid more than $2,039 after the panels are installed on your home. Here's how it works.
Sorry about that.
That's okay. That's all right. Thank you.
That's okay. We can charge them for a few seconds of advertisement.
Yes, absolutely.
So our mission at the Brain Tumor Network is to provide compassionate and personalized high-touch navigation to patients and their caregivers in the United States who have been impacted by a primary brain tumor. And we have another video, hope it doesn't complicate things, that really explains what we do.
Great. I will go back here and
Thank
play
you.
it. No problem.
If you or a loved one has been diagnosed with a primary brain tumor, chances are you have more questions than answers. The amount of information you receive can be overwhelming, and you may need support in navigating your diagnosis, treatment options, and available resources. The Brain Tumor Network was conceived by a family who knows firsthand the difficulties faced when told you have a brain tumor. Brain Tumor Network is dedicated to guiding you and your loved ones through the often complicated brain tumor treatment journey. This personalized navigation service is offered at no cost to patients and caregivers. Personalized navigation is guidance provided by experts to help you understand your diagnosis and get you connected to the care and resources you need quickly and efficiently. Our navigators build meaningful connections with you to understand your priorities and guide you to treatment options based on your unique situation. Your dedicated navigation team will remain with you for the duration of your care at Brain Tumor Network, helping provide guidance and information for services including understanding treatment options, clinical trials, second opinions, education, emotional support. The Brain Tumor Network believes no one should travel this path alone. We are with you at every step, ensuring you have access to the best possible care, support, and answers to your questions along the way. Request a consultation today at www.braintumornetwork.org or by calling 844-286-6110. We stand ready to assist you.
Thank you. Next slide, please. So one thing that makes us unique, through the United States, there are navigators within certain medical facilities. We are not associated with any institution, medical institution. So we really try to take an unbiased approach and really don't steer any patient to any certain institution or a provider. What we do is we connect patients to disease experts and facilitate consultations. We assist with locating treatment centers with a focus on centers of excellence. We provide education on current approved treatments for brain tumors and the side effects. And we locate second and third opinions while considering geography and ability to travel. We really look at the number of patients that the providers have seen and their experience with it to really direct people who might live in rural parts of the United States to more experienced providers with a focus on neuro-oncology. Next slide, please. So one of our signature services, about 30% of our patients really need help finding clinical trials. We have built our own proprietary clinical trial matching system, which takes into account the location of the tumor, if it's a second or third occurrence, and the biomarkers and molecular profiling to find clinical trials that the patient might be eligible for. We then will reach out to the institutions to find make sure they're still accruing patients before we offer them as suggestions to patients and caregivers. We also collect medical records on behalf of the patient and deliver them to different providers on behalf of the patient when they're looking for second or third opinions or clinical trials. I try to say we really try to take some of the administrative burden off of the patient so they can just focus on getting the care that they need. Our navigators also assist with answering questions and topics to discuss with care providers. A lot of times patients and caregivers don't even know what questions to ask. So we're happy to provide some of those questions for them. We're also happy to virtually go to the patient appointment with the patient. So whether that's on a Zoom call or a phone call, we are able to do that and just really listen and help interpret later on any questions or answer any questions that the patient caregiver may have. We have social workers on staff that help with referrals, psychosocial support care along the care journey. Really, these social workers help with palliative care discussions, long-term planning, and help locate financial resources. We do not provide medical advice, opinions, or recommendations. We really present different options for patients and caregivers to discuss with their care team. And all services are provided at no cost at all to patients and their caregivers. We rely truly on philanthropic support. Next slide, please. We have a team approach. When someone contacts us, they are immediately assigned a neuro-oncology nurse and an oncology social worker who will be there with them along the journey. So anytime that they reach out to us, they will receive answers from the same social worker and the same nurse. And that relays their Brain Tumor Network care team. We call that our co-navigation model. We also have a retired neurosurgeon on staff, so we can consult with him at any time if we have any questions. And then as a team, we really address each patient, make sure they're well supported. We do a psychosocial intake and a medical intake to make sure we're addressing their needs, concerns, and goals that they may have. Next slide, please. And you might want to hear from Jeremy and Kelly on their experience with the Brain Tumor Network from their perspective.
I had gotten a call from Dr. Willis. He said, "Hey, I hate to do this over the phone, but it looks like you have a glioma about the size of a golf ball, and I need to get you in an MRI machine as soon as possible." I basically just kind of started crying on the spot.
At that point, the doctors were very much telling us, we don't know what it is. We just know it needs to come out. It was 7 days from his first symptom until surgery. So it was just a whirlwind. I mean, just like everybody says, an experience like that is going to be. For me, one of the things that I feel like has come out of this is remembering the importance of not always looking for something to look forward to, but to look forward to what's happening right now. Today is what today is, and to be grateful for that. I think we really try to do something every day that we can look forward to. Let's find a new TV show to watch as a family. Let's go on a family bike ride together. Let's go on a hike together. Let's kayak together. Yeah. It is pretty cliche when you hear people say, you just have to appreciate every day for what it is. You have to live in the moment.
But you do.
But it's cliche because it's true, and you do have to do those things.
You know, I think every hospital, in theory, wants to treat the whole patient, but it doesn't always work out that way. And I think that the Brain Tumor Network,
they really have kind of provided a wide spectrum of services, and they provide the emotional support, but also the resources and the information, and help you figure out what questions to ask. And I think they're providing the information that we need and the research that we need, but also encasing that in the emotional support too, which is the way we need it delivered. Yeah. You know, I think right now what specifically has been the most helpful for us is they are really helping us to research clinical trial options, because they can put in the legwork. They can really do the research to find what's out there that we don't even know about, and that we don't always have the time and mental energy to look into.
It's a lot for everybody to go through this, right? And it also is nice to have somebody to tell all of this stuff to.
Yeah.
Without adding more stress.
I think when you find yourself in a position like this, that you have to go seek out that help and not wait for it to come to you. The Brain Tumor Network they've done a lot, and I know that they're going to continue to be there for us.
Thank you. Next slide. So you heard Jeremy and Kelly talk about our clinical trial navigation. Like I said before, that's a signature service for us. And we really focus on this because we hear a lot from patients that they are fearful of enrolling clinical trials. They don't know how to go about it. They find it difficult to access information about clinical trials. They're unsure how to search for and understand the eligibility requirements. They're also fearful of discussing this as an option with their current care team, especially if their provider has not brought up clinical trials to them. And then a lot of them face barriers with location or financial challenges. So we really go through each one of these barriers and see how we can help break down that barrier with them. Next slide, please. Patient record, we would collect patient records from every provider that they've seen, and we use them to make sure we are finding personalized and unbiased clinical trials that we may be eligible for. We have developed relationships with brain tumor centers nationwide. Actually, we have relationships with over 500 providers. And so we can really reach out to some of the PIs or clinical trial coordinators and discuss each case with them to make sure it would be a good fit. We also have our own proprietary software system that helps us vet the clinical trials and make sure it may be a good fit for the patients. Next slide, please. About 30% of our patients contact us wanting help securing second and third opinions, just to either verify the information they're getting from their current care team or to seek out different types of treatment. So we are happy to do that because we have been doing this for many years now. We are able to find different providers for them. We help reach out, make the appointments for them. We can facilitate virtual second opinions or just have different care teams review the medical records for us. We will do this for all phases of the brain tumor journey with neuro-oncologists, radiation oncologists, neurosurgeons, neuropsychologists, or neuropathologists. Next slide, please. Most of our patients are requesting some sort of patient education, so we are happy to provide that as well. And we do this throughout the whole brain tumor experience. This includes helping them understand their diagnosis, different treatments and side effects associated with those treatments, and as I mentioned, clinical trial opportunities. Next slide, please. As I mentioned, we have oncology social workers on staff, and they provide the emotional and psychosocial support. A lot of this has to do with adjusting to having a new diagnosis and coping. We help navigate family communication and difficult care discussions. Oftentimes we will do Zoom calls with the whole family to really help navigate the emotional impact. Fear of cancer reoccurrence, we walk through patients through that. Survivorship concerns, and locating resources to assist with financial assistance or practical needs such as speech pathologists, wheelchairs, or walkers. Next slide, please. We are happy to say that 100% of the individuals who are engaged with the Brain Tumor Network in 2020 were satisfied with the services that they received, and 100% would recommend us to others. 94% felt that the navigation they received helped them better cope with their diagnosis. And 87% indicated that the navigation they received helped them feel more empowered to engage in open conversations with their care teams. Next slide, please. And that is my presentation. Thank you again for giving me the opportunity to be here. I am happy to answer any questions over phone or email, and our contact information is on this slide. Thank you.
Great. Thank you so much, Kristie. This was extremely insightful. I think you mentioned that this started about in the last 10 years, this concept of patient navigation, and I can just imagine how helpful it would have been for in my experience, if we had one single point of contact throughout our journey. So thank you for sharing this. I will definitely connect with you to